Hi, this is Professor Teresa Sarinda. Today, I will be going to discuss to you about the roles of the nurse as health educator. Is a discipline and profession. The goal of discipline is to develop knowledge in sustaining, caring humanity and health. Teaching is also a major responsibility and essential part of high quality care. Nurses' role, which make more unique, is to serve as an advocate of health to attain optimum level of wellness and manage diseases. The first topic is about nurse as health educator. If we say nurse educator, it's not only from traditional positions of being a giver of information to that process of designer or coordinator. So it means that it's not only that we give information to other people, but also we plan ahead of time. We coordinate what suitable healthcare programs to a certain individuals, families, and community. And the second one is a teacher-centered to a learner-centered. Before, we only focus on giving information and we emphasize on health teaching. But right now, we also learn how to listen and become a learner as well. So in this case, we assess what we call the skills that needs assessment. We involve also the learners in planning because this is necessary, and it also will link to a teachers learning resources and encourage learners initiative. We have the elements of an ideal relationship in health education. So first is we have both parties should have trust and respect. It is necessary for us to have what we call respect. In order for us to build the trust of our patient is we must show respect to our client first. By that, if the client is was able to trust us enough, then he or she will provide an information that necessary in the healthcare system. The second one is the student can learn and it is a sensitive. So this is also means of the teachers assume that the student can learn, but it is necessary for a teachers to be sensitive enough if that particular client or if that particular student really understand well the concept. And the third one is both feel free to learn and make mistake. So sometimes we have mistake that have done in the past, but it's not only on a negative aspect because those mistakes will be able to mold us to become a better person if we know on how we're going to use those mistakes as our experience to develop a better person. We have a roles of a health educator in health promotion. The first one is the facilitator of change. In the facilitator of change, our goal here is to promote health, wherein the following are effective in facilitating change, just like analyzing, we're going to explain, we're going to divide complex skills, demonstrate, practice, asking question, and provide closure. These are the effective things in order for us to promote the learning situation or to adapt whatever changes to our learner. It is important for us to analyze the situation first. Are the client really uh, are the clients is really attentive enough when we having our health teaching? It is also necessary for us to explain well and to demonstrate as well. The second one is a contractor. If we say a contractor, this is the first is you're going to state a mutual goals to be accomplished. So this is very important. What will be our goals that we want to accomplish? The second one is devising an agreed upon plan of action. That's why we need to incorporate our client or the student in having our plan as well. And of course, we're going to evaluate the plans. Is it suited? And we should also provide an alternatives, and it should also improve the trusting relationship between. Number three is an organizer. An organizer is there is what we call focus on the manipulations of materials and space. So it determines also the sequentials or the organization context from simple to a complex uh, with a certain healthcare plan perhaps. And we're going to determine what will be our priority. Number four is evaluator. An evaluator, of course, it is an evaluative process that are integral part of all learning. So this may include either self-evaluation, learner evaluation, organization and evaluation, and the peer evaluation. Number five is the coordinator of care. For the coordinator of care, we must ensure the consistency of information. So, nurses can support their clients in their efforts to achieve the goal of optimal health. They can assist also their colleagues in gaining knowledge and skills necessary for the delivery of professional nursing care. And the last one is the trainers of trainers. It means that we should help also to develop, we should train all other healthcare workers in order for us to have that successful healthcare goals in our certain communities or in our societies. The end of my presentation. Thank you so much for listening.